San Diego. This is Fox 5 News.
Well, at first I felt that it was confined to my liver, and that the operation had completely removed it, so I felt quite relieved. And then that same afternoon, we had an MRI of my head and neck, and it showed up that it was already in 4 places in my brain. So I would say that night and the next day, until I came back up to Emory, I just thought I had a few weeks left. But I was surprisingly at ease. You know, I've had a wonderful life. I've had thousands of friends, and I've had an exciting and adventurous and gratifying existence. So I was surprisingly at ease, much more so than my wife was. But now I feel, you know, that it's in the hands of God, whom I worship, and I'll be prepared for anything that comes.
That was former President Jimmy Carter speaking pretty candidly this morning as he talked about his fight with cancer. Joining us to talk a little bit more about his diagnosis and what lies ahead is board-certified oncologist Dr. Charles Redfern. Doctor, thanks so much for being here.
Thanks for inviting me.
One of the things I want to ask you about is melanoma. And please forgive my ignorance here. I think melanoma, the deadliest form of skin cancer, but that was what was found in 4 places, as President Carter was talking about there, on his brain. Explain that for me.
Melanoma is the deadliest form of skin cancer, and it can often be found only on the skin, but also in other places of the body, such as the liver or in the brain. And of course, we're very concerned and worried about that in him because it's in his brain now.
He started treatment today. He's actually doing radiation. In your experience as an oncologist dealing with cancer patients, talk to me about sort of his prognosis. He said pretty candidly there that he thought he only had a couple weeks. Will this radiation, you think, get rid of the cancer in his brain?
Well, I think he's going through what a lot of patients do, which is shock and worry right now. He's certainly going to live more than a couple weeks, but this is advanced melanoma, and everybody's very worried about it. He's going to get specialized radiosurgery now, it sounds like, at Emory University, which should clear up, for now, what's in his brain.
And so if you had to give him sort of a prognosis, what would you give him?
Well, that's hard to know. He's, you know, older, and, you know, he may live a year, but with newer drugs, he may live longer than that. And it sounds like from one of the news sites I was reading, he's probably going to be on one of the newer immune drugs, and some patients can live for years with those.
Doctor, let me ask you about family history. It's been pretty well publicized that former president had several people in his family die of cancer. What kind of role does that play in his future here?
His family is very well known because they have what's called hereditary pancreatic cancer, which in some cases can be linked to melanoma, and you know, he's probably had a thorough examination with a clinical geneticist, which you want at a big academic center or at a site where I work at Sharp Memorial Hospital.
Yeah. All right, Dr. Charles Redfern, thanks so much for joining us. We really appreciate it.
You're welcome.